Welcome to the Prospective Doctor podcast, brought to you by MedSchoolCoach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hi, everyone. Thanks so much for joining me today. Today, I'm joined by Dr. Diaz. Dr. Diaz is one of our newer advisors with us at MedSchoolCoach, and he's also a general surgery resident at Ohio State University in Columbus. And he joined us today because I just really wanted to have him chat with us about general surgery, tell us a little bit about his story, how he got into general surgery. And for those people out there that maybe are thinking about surgery, give some tips on what to expect and maybe what to start thinking about if you're in medical school, or even if you're a pre-med, kind of what are some things you should be thinking about if this is a possible interest for you. So Dr. Diaz, thanks so much for joining me today.
Yeah, thanks for having me. It's really an honor, and it's always quite humbling when someone asks you to give your opinion and your advice for something you feel like you're in the middle and the thick and thin of. So I'll be happy to share whatever information I have I think might be useful that others have shared with me along the way.
Awesome. So how about could you start a little bit on just telling us and the listeners today about where you began your interest and how your kind of path to general surgery got started?
Yeah, I think that's a good place to start. For me, even before I started medical school, I was already thinking about surgery, but I was thinking about surgery more broadly. So I knew I was interested in something procedural. And that interest came from a really lucky, fortunate experience I had that I was able to travel abroad with the Navy on a humanitarian mission trip. And at that time, I'm fluent in Spanish, and this mission trip was to South America. So I was serving as a translator, and I really thought that I was going to go to medical school. I was in the process of applying to medical school, and I thought that I would go into something like primary care, family medicine, or at most something like infectious disease. I was really passionate about tropical medicine, global health. Mm-hmm. And through a number of circumstances, I was asked to fill in for a translator in the perioperative area. So this is the area that patients were getting prepped for surgery, where families were waiting for their loved ones to get out of surgery. And that day, everything just changed for me. The instant impact that I was seeing patients go into the operating room with, for example, polydactyly, an extra digit on their hands. And 45 minutes later, they were coming back out of the operating room and they were able to use their hand to write, something they had never been able to do their entire life. It just clicked for me, and it changed my entire perspective of why I was going to medical school. And that moment, I said to myself, I'm going to medical school to be a surgeon. I don't know what type of surgery that will be, but that's why I'm going to medical school. This is kind of the skill set that I need to have.
Right. That's awesome. And I think that's great too, that you had such an impactful moment. And I know a lot of people have those kind of moments and a lot of people don't. What about, was there, as you're going through med school, did you ever kind of get off that path? Did you think about, there's, other specialties that I'm really interested in? Or were you kind of for sure going for surgery, once you got started?
Yeah, no, it's an interesting question because, like I mentioned, I was really passionate about global health. I was really passionate about public health and still am. In fact, most of my research is in this area. But the traditional surgeon, if you will, or at least the traditional surgeon at the institute I was at the time, was not a surgeon who was particularly passionate about public health or global health or even global surgery at the time. So I really went back and forth between my clinical interest, which was surgery, but my other healthcare interests, my other research interests, which were more on the global health or the public health perspective. Uh-huh. So I did go a little bit back and forth between, was I going to be able to align both these interests into a career that would satisfy both these desires for me. And we'll talk about mentorship I suspect here in this podcast, but, through really important connections and really important mentors, I was able to start to shape a career that I thought would fulfill both those needs.
Yeah. And so can you tell us a little bit about how you are kind of fulfilling both of those needs and how you pursued that through your residency now?
Yeah. So I think, one of the most important piece of advice that I got pretty early on in medical school was that you needed to have a team of mentors. It wasn't just having one primary mentor, but having a group of mentors that could fulfill all your needs. So for me, that was having a couple surgeons, some that were early on in their career, some that were more senior and established, but that were pretty diverse and were able to give me a different perspective on their life as a surgeon, as well as, fit different needs that I needed. But I also sought out other mentors who either were in the Department of Family Medicine and were doing very interesting things around population health, or were in the Department of Infectious Disease and were doing very important things globally. And that filled my need for that desire to do research in that area. And I was very transparent with everyone, and they were very good mentors in that I think a lot of them communicated with each other and in helping me start to fill sort of all the needs that I needed and helping me see what a career as a general surgeon who might be interested in health policy or public health might look like.
Yeah.
And, that led to, pretty, divergent course, but ultimately I would do an MPH during medical school. I'm in residency now, and I'm actually doing the first of 2 years of research as a health policy researcher at a separate institute outside of Ohio State. So these are things that are a little bit non-traditional and have only been possible because I've had, the privilege of having this group or this team of mentors that have really helped me shape that.
Mm-hmm. So what would you say for people, that are, I know you're mentioning mentorship, which is just so important. Even no matter what specialty you go into, but for some people maybe that are interested in surgery, or they're not totally sure if they're interested in surgery. What should they start doing? Should they start shadowing if they're pre-med? Should they wait till they're in medical school? How do you suggest people explore that interest?
Yeah, I think that I would never discourage anyone from shadowing, even if you're just a pre-med. I think that that's a wonderful opportunity. Whenever you have that chance, you should take advantage of it. But I think more importantly than shadowing early on, I think is really getting to know yourself. Identifying what kind of life you want to have, both professionally, academically, but as well as your personal time. And medicine is an all-encompassing career, whether you're a surgeon, whether you're family medicine, internal medicine, it's going to take up a large part of your time. So I think getting to know yourself, your values, your morals, your phenotype in things that are most important to you will then help you realize and pick out those things when you start shadowing that you resonate with, that you connect with, the things that you can say to yourself, oh, I can see myself doing this for the rest of my life, or I can see myself being like Dr. X for the rest of my life, or even tease out little things like, I like this about this specialty, but not that. Is that something that is flexible, or is that something that if I'm going to commit to that said specialty, that's something that I have to get used to, that's just going to be the part of my life. And I'll give you one example for general surgery. One of the things that really turn students away, I think, is this idea that, we get to medical school and for most surgery clerkships, it's very academic. Most of our surgical mentors have their entire life practiced at a university, have had a certain type of call schedule, may have probably worked, 60 to 80 hours a week their entire life. And that can be not appealing to certain medical students that might be interested in surgery. But there's a life and there's a whole career of general surgery that lives outside the university or outside the academic sphere. And that's the community surgeon or the rural surgeon, the private practices. And unfortunately, if you live your entire life in the university or the academic medical center that you train at, that's something that you're never exposed to. So for the medical student that might be interested in surgery, I always recommend that beyond shadowing at their university, they seek opportunities out in the community, because it's a completely different practice. It's an essential practice, and it's something that we're not exposed to in medical school. So, if you're thinking about surgery, but you're not sure if you fit this academic phenotype where you think that you might not want to do research, or you might not want to be an educator, but you do want to offer surgery to patients, but in a more private practice setting, that certainly is available to you as well. It may be a little bit harder to seek out, but it is available.
Yeah, and I think that's such a good point too, because even from my own experience and experience of my peers, I was actually really interested in surgery in medical school, but every surgeon that I actually worked with on my rotations and stuff, it was just like, oh my gosh, this lifestyle, I don't think I could ever do this. They're working, like you said, 80 hours a week, and they're attending physicians, and, they're balancing research and their academic obligations and things like that. And I don't think I could do that. But, now in hindsight and seeing how actually surgeons in the community practice, it is much different. So I think you kind of get almost a clouded picture of surgery in medical school. So, I think that's such a good point, is like, if you're not sure this is your exact mold, go out and see how some other ones practice too. And you may find that this is the right field for you.
Yeah, absolutely. And I think, another important point is traditionally, historically, the field of surgery was a little bit of an old boys club. And for a long time, it was, pretty insular, but it's diversifying incredibly, both by gender, both by race. So if you're at a place where just you don't see people like you in the specialty that you're most interested in, those people are out there and they exist. And again, that it may be if you are a female and you're interested in surgery. I know that a lot of my best friends are female surgeons, but they have struggled to find mentors. But they certainly are out there. So I encourage you, any student to diversify, to seek mentorship even beyond their own university. Especially, in this, the time that we live in, it's so easy to find mentors through social media, Twitter, a number of websites. They're all out there. So, just because you don't see someone that looks like you or has a life that you think you want to live, it's probably out there. You just, have to work a little bit harder for it.
Yeah, that's such a great point too. And I think true of definitely with surgery, but a lot of other specialties too. That, maybe like you said, you don't see the exact mentors or people like you in there, but they definitely are. And it may take a little bit of extra effort to find them, but they are definitely available. Yeah, that's great. Excuse me. What about, talking a little bit about residency? What is the residency like? I think for most people, they think, of surgical residency being very, very difficult, time consuming, and, a trying period. How have you found your residency to be?
Yeah, I think at certain moments, all those things are true, but I don't think that they're unique of surgery residency. I have many of my closest friends are in other medical specialty residencies, and they also have trying times and exhausting weeks and work many hours. But generally speaking, general surgery residency is at least 5 years. There are certain programs, more academic programs, that will require 1 up to 2 years of research. So there are some residencies out there that even going into them, that they're going to require 7 years of your time essentially. But 5 of those will be clinical. And, I always, when I talk about how long surgery residency is, I always like to take a moment and point out that, a lot of students will say 5 to 7 years is such a long period of my time to spend training. But I think one point that we often miss is, for example, any of the medical specialties, you're going to spend at least 6 years training. Internal medicine is 3 years. And then if you want to do, for example, cardiology, that's another 3 years, or, pulmonology is another 3 years. So, it's 3 and 3 of fellowship, but it still ends up being 6 years. Mm-hmm. So my point is, if you really love something, whether it's surgery or something else, but, the time is turning you off, the reality is that for most surgical specialties for most specialties anywhere, you're looking at least 4 up to 5 to 6 years of training anyways. Right. So you might as well pick something that resonates with you, that you'll be happy doing for the rest of your life.
Right.
And then generally surgical residency, your first year up to 2 years is not all that surgical. You're learning to manage patients. You're learning to diagnose patients who have an operative condition, but you are taking care of patients on the wards, on the floors. You're doing admissions, discharges, things that, quite frankly, every intern is learning to do for the first time.
Yeah.
And then it is gradual as you move on through residency. You participate more and more actively in surgeries or operations that are appropriate for your training level. But with that being said, the ACGME now has a relatively new requirement that you have to have logged 250 cases by the end of your second year. So, you're operating at least 250 times within your first 2 years. So it is pretty, immersive in terms of operating, pretty quickly. Mm-hmm. And then, by your 5th clinical year, most of the operations that you're doing, you're taking a teaching role. So you're teaching the junior residents how to perform most operations. So you are at a point where you're pretty independent as a 5th year.
Mm-hmm. Yeah, absolutely. And then lastly, could you talk about you're interested in specializing in surgical oncology, and also keeping an interest in global health research. So I know we talked about it a little bit, but how did you kind of find your surgical niche and, where you want to specialize in eventually once you do finish?
Yeah. So going back to medical school, like I said, I was interested in something surgical. And I went back and forth between things like general surgery, things like ENT, ear, nose, and throat, plastic surgery. And the reason I went back and forth between them is because this is what I had seen in my experiences. This is what I had heard mentors talk about, or what my mentors actually did for a living. But ultimately, as a 3rd-year medical student, when I was on my surgery clerkship, I spent a month on the surgical oncology service. And it was the operations, but more importantly, the patients that resonated with me the most. I think going back to my first experience of seeing a patient with an ailment, and a certain time later, you as a surgeon were able to alleviate that ailment, was the most obvious to me in cancer operation, whether it was a patient who had a breast cancer or thyroid cancer, and we were able to eliminate that mass, and that patient was successfully treated. That to me was what surgery was all about. So at that moment, I started to realize that I was probably going to be a surgical oncologist. And you through 4th year, you rotate on other surgical services, and then in residency, obviously, you rotate through a number or all surgical services essentially. And nothing quite has resonated with me the way surgical oncology has, for that ability, to treat that acuity of an ailment as a surgeon. So, there's things can always change, but I like to say that I'm pretty much close to 99% committed to surgical oncology at this point.
Yeah. Well, that's awesome. Well, Dr. Diaz, thank you so much. This has been super helpful. And I think it really gives kind of almost a non-traditional view to people thinking about surgery. I mean, I think it's so refreshing to know, like, you can make it your own. And, there's different paths. Everybody has a different path to surgery, and what you want to do and how you want to balance your other interests can really be up to you. So I think this is super helpful for people interested in it, and maybe even deciding like if this is what I want to do, or if, can I combine it with my other interests? So thank you so much for joining us and giving us this information.
Yeah, it was a real pleasure to talk with you. I hope that your listeners found something useful out of this. And I think that's a great, takeaway point. And not just surgery, anything in medicine, that you can make it anything that you want. You don't have to follow the mold. With the right team around you, you can find the niche that fits all your interests. I encourage all at any level that you're in, to start to think about that.
Yeah, that's awesome. I think that's a great point. And I think sometimes in medicine and people going through it, we kind of get that sense that you have to just do it a certain way. But you're exactly right in case in point that you can make it fit how you want to and have multiple interests, and still do public health research and be a surgical oncologist. Like those are, seemingly very different interests in different areas of medicine, but I think it's great that you've combined them both and, are focusing on what you really want to do. It's a great lesson.
Yeah. Well, like I said, everything, they like you said, they may be different, but everything in health, I think, is ultimately connected. I always say it's public health and it's policy, but, we all at some point in our life will need a colonoscopy or a mammogram. And that's as much public health as it is a surgical oncologist, intervention. So it's all connected at the end. And I think it's as much as like how you build your story and you tell that story and make those connections for people, that really allows you to shape your career.
Yeah, absolutely. Well, awesome. Thanks again, Dr. Diaz, for joining us. And for all of those out there, Dr. Diaz is available as an advisor, also can help with residency advising too. So if you are interested in surgery and, want to speak to him, definitely reach out to us at MedSchoolCoach.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.